Hello, and welcome to our Healthcare Workforce Investment Fund Implementation Plan webinar. This is an exciting bit of legislation for both campuses and industry partners and will benefit the Commonwealth through strengthening the next generation of the healthcare workforce. I'm Leslie Sizemore, Associate Vice President for Workforce and Economic Initiatives at the Kentucky Council on Post-Secondary Education. And today I'm joined by two of my colleagues, Travis Powell, Vice President and CPE General Counsel, and Michaela Manier, CPE Senior Associate for Healthcare Workforce Initiatives. During this webinar, the three of us will review the purpose behind the Healthcare Workforce Investment Fund, go over the regulations, and share the implementation plan. This webinar is recorded and it's shared on CPE's website. Please note that although we're not doing a formal Q&A during the webinar, you're welcome to reach out to our team after the webinar for any questions you may have. So with that being said, let's get started. Today, I would like to begin by sharing the vision and the purpose of House Bill 200 and how that concept led to the development of the Healthcare Workforce Investment Fund. House Bill 200 passed in spring of 2023 and was introduced by its primary sponsor, Representative Ken Fleming. The legislation shares responsibility between industry and government to carry out a dedicated mission to cultivate a robust healthcare workforce in Kentucky and to support healthcare students through education to employment. It hinges on an establishment of a public-private partnership, incentivizes healthcare education programs, healthcare industry partners, and state leadership to strengthen the education and training pipeline of healthcare professions within Kentucky to better serve patients across the Commonwealth. In doing so, this creates healthcare access for our citizens. Some of the core objectives for House Bill 200 is to provide educational scholarships to students pursuing programs targeting critical workforce needs in healthcare professions. At least 65% of the funds will be targeted for this. And recognizing and rewarding excellence among Kentucky healthcare professional education and training programs, and this will account for up to 35% of the funds. We're currently waiting to know the level of funding earmarked for this fund by the General Assembly, and we'll be reporting that out as soon as we know that information. Now that we have discussed the foundation for the fund, I want to turn over the discussion to Travis, whose continued involvement with House Bill 200 and the establishment of the Healthcare Workforce Investment Fund has been critical. Travis, could you take some time to go through the regulations that were recently approved?
Thanks so much, Leslie, and absolutely, I will take you through these. These regulations were actually just finalized last month. So we finished our final testimony on the regulation for the Education Committee, and so they were finalized in November. So they are now complete, which we're very excited about. And much of this that I will walk you through today will be very similar to what Michaela will talk about as far as in relation to the implementation plan, because so much of what we do here in the regulation outlines the process that will be in the implementation. But as you can see here, in the first section here, we have our definitions. The one that I will point you to, most of these definitions here are already defined in statute. But we did create a steering committee in the regulation, in both the regulation for the incentive funds and for the healthcare scholarship fund. This is the healthcare scholarship and training regulation that outlines the allocations of fund under that program. And the steering committee will be a group of individuals established by the council to essentially give recommendations and guidance on funding allocations under both programs. And you can see there the composition of those members. We've already populated that group. I'm sure Michaela will be talking about that shortly. very excited to get some expertise and guidance from these individuals. So this is the first real substantive section talks about notice of funding opportunities. So each year that funds are available for distribution, the council will publish notice of the availability of those funds. And the notice shall include the funding period under which it's available, the date to which submit a partnership proposal, the dollar amount available of matching funds, the weight and criteria for evaluation, and how to actually submit a proposal with a targeted date for making awards. To be eligible, a partnership proposal shall include from the healthcare partners and the healthcare programs, the certified signature of the chief executive officers and of each organization, as well as a designated point of contact for substantive matters related to the program. Certification that the healthcare program is offered by an eligible entity and that completion of the program meets the eligibility requirements for certification or licensure in Kentucky. This is one of the things that changed as part of our regulation adoption process. We modified this section and did say that originally that the programs need to be licensed by the Council on Post-Secondary Education or the Commission on Proprietary Education. But we realized that some of the eligible programs were not licensed, were not required to be licensed by either entity. So we made that definition a little bit broader, but just to ensure that once you complete the program, that you can actually be licensed to practice in that area in Kentucky. So we need certification of that before a proposal will be eligible. The proposal, the budget amount for the program, how much will be contributed, and the match amount that will be provided by the healthcare partner. A narrative explaining how the institution plans to use the partner contribution and match the funds, the award scholarships, and healthcare credentials. Talk about, in addition to description of the plan for student recruitment, scholarship award, and selection process. We'll also get information on how the program shall increase student enrollment in the credentials completion and how they're going to meet local and regional workforce needs. We'll make the institutions and the partners describe and give an explanation of how the partner will onboard and retain graduates and how graduates will be supported through their service obligations. So we want to make sure that this goes beyond just the issuance of a scholarship. We want to make sure that our students and ultimately our graduates are supported all the way through completion of their studies, through the time period in which they're going to have to serve in order to maintain the scholarship amounts. A response to any other criteria that we include as determined by the steering committee, and other certifications that need to be made. So once that's received, there will be an evaluation process. The steering committee shall review and rank each proposal to the extent they meet the priorities that we set forth in the prior section that we just discussed. Once the proposals are evaluated and ranked, the committee consider the distribution of funds to avoid a concentration of small number of partnerships before determining final amounts awarded and the number of awards to be made. So we may see requests for more funds than we have, more funds to be matched than we have. So rather than making decisions to where we have to cut some proposals out that are very valid and useful proposals, what we would do there is potentially just reduce the amount of scholarship provided in each submission. That way we could spread the money that we receive a little bit more through the different partners rather than just consolidating it in potentially one really large match. Once those programs or the proposals are evaluated, then we will council will make the awards. And we'll enter into a contract with the entities, and then we will disperse the funds to the healthcare partner and along with the matching funds as required by the General Assembly. And then once the awards are made and the contract is finalized, we expect that the scholarship requirements will be enforced per the proposal, and we also require some reporting back to CPE as well. As for the healthcare program incentive funding, it's set up in a very similar way, and you'll see the same steering committee is created. We put this in two different regulations just to help it be more clean and more delineated between the two programs. But essentially, this is the same steering committee. The steering committee will serve for both programs. And much in the same way, we will receive proposals. We have a section for dedicated funds and without dedicated funds. Without dedicated funds means that there are no essentially donor requirements related to the funding. The bill, House Bill 200 allows us to take in grants or proposals from matching requirements that have stipulations set forth by the donors. So these would be for incentives that did not come with any such stipulations. So essentially, it's again a very similar process. Certification that the program is offered by an eligible entity and that the program meets the eligibility requirements for licensure in Kentucky. A budget for how the incentive funds will be used. A little discussion about how the credentials align with the high demand workforce sectors. And if they're not aligned, we have to see proof of workforce demand. We want some information on student retention and graduation, as well as how the annual degree production of the credentials has increased over the past 5 years. So is the program really being worthy of an incentive? Has it been performing over a longer period of time, and has been and maintained that level of success over a long period of time? Is one of the things that we would use to evaluate. And the other things here that I won't read to you, but just to give you an example, learning experiences offered by the program, job placement, that sort of thing. Just more things that describe the excellence of the program. And much as in the scholarship proposals, incentive funds will be evaluated by the steering committee. Again, I'll take a step back to say that proposals with dedicated funds would be essentially the same, but it would also include any criteria determined by the grantor, any stipulations that they put on the funds for incentive funding. They would have to, the potential awardees would have to respond to that as well. The evaluation process would work just the same way that it did under the scholarship proposals. They will be ranked and evaluated by the committee. And then again, the committee would look and may reduce potential awards depending on the number of applicants that we have in order to give out more incentives. And then once the incentive awards are made, then the council would enter into a contract with the healthcare program to distribute the funds. And again, this is all outlined in regulation. Encourage you to take some time to take a look at these now final regulations. And Michaela, again, will touch upon some of these items in the implementation plan when she speaks next. Thank you.
All right, thank you so much, Travis. As you all can tell, the regulations were incredibly thorough, so it made my job very easy. And I got the privilege of work alongside Travis and Leslie to develop the implementation plan. And so we're going to walk through the next several slides that really take what the regulations and the statute laid out for us, and we're just applying it to the actual process we're going to go through to actually implement this over the next 8 to 9 months. So first and foremost, as a reminder, when we're looking at that pot of money that will be at least 65% of the funds, that'll be those healthcare training scholarship partnership proposals. Whenever we are asking individuals that are interested in this pot of money and through their partnership proposals to really think about is what the General Assembly really laid out. We're going to prioritize those proposals that are going to address the needs in a historically underserved county. We're going to think about how it's going to improve diversity across that healthcare credential. We're going to look at the workforce demand for that credential. Is there a shortage in our state for that credential? And if you remember in the statute, there are around 14 areas that we are really focusing on. And then we're going to see what the size of that healthcare program actually is with that partnership with the healthcare industry side. And so these are some priorities that as you're thinking, would you want to apply for this, to really consider gathering information on how you might meet these priorities. With the other allocation of what we intend to hopefully be 35% of the funds for those healthcare program incentive dollars, the priorities are a little simpler. We're going to look, of course, at that workforce demand and the capacity for the credential in our state. We're going to see once again if that is meeting the needs of an underserved county. And we're going to also look at the student success surrounding that credential that's applying, what the graduation rate is, enrollment rate, and other metrics that are traditionally used to look at retention and student success. And so to really help us guide our conversation around these priorities and carrying out the decisions that will be made later on in the summer and fall, as Travis said, the regulations really laid out what we needed for a steering committee. So we really went with the recommendation to have 10 members. So of course, we wanted to keep it as even as possible across the healthcare, state government, and post-secondary education realms, just as the regulations recommended. And so what you'll see there is we do have one of our CPE council members represented, but we also have 3 from each industry area. And so what we really wanted to do was to bring individuals to the table that were either nominated or had expressed interest in serving that could represent a large variety of post-secondary experiences, of different affinity groups within healthcare, and had a wide range of experience themselves to bring to the table, whether they've worked maybe researching the healthcare shortage or other areas such as that. And so we are really excited to bring this group together for the first time in March. They are going to meet in March, in May, and July, and then we'll schedule meetings from there. But these 3 first meetings are really formative because we're going to first use the March meeting to onboard these individuals, really root them. I know many are on the call today as well. Really root them, though, in the purpose and setting the priorities as the tone of what we're going to do moving forward in March. And then in May, we're going to meet again to finalize the criteria, the rubrics, and the templates that we are going to release for anyone interested in applying. And then in July, we will walk through the scoring process. And we'll dive a little bit deeper into that here in a second. And so as you've been told by Travis and now myself, the steering committee is really key in helping us evaluate these applications. And so what you'll see on the screen is as it currently stands, we have 2 evaluation rubrics, one for each pool of funding that we are going to build off of. And we're going to start building off of this in the the May meeting, based on information we learn about with the funding, hopefully closer to April. And so once we know more for sure about what funding we do have, we're going to finalize the criteria that we're going to be using to grade and score each of the applications with the steering committee. Right now, what you'll see is we're kind of thinking to just lay it out just like the regulations put it. We're going to look at the supply and demand of the credentials. We're going to look at the geographic area they're serving, the size of the healthcare partner. We're going to look to dedication and student success. And then, of course, in the case of the program incentive funds, we're going to, of course, look at the graduation rates of those going through the credential program. You will notice at the bottom of each of those rubrics that we are going to allow, if they choose to do so, the steering committee to help us set one final criteria based on either their knowledge and industry experience or based on what we learned over this legislative session with the funding. They may decide to keep the criteria as it stands, and we'll just reevaluate the point allocations, but we are going to, of course, finalize this rubric criteria and the final priorities, as well as a manual that will be used to showcase what the forms for the proposals will look like. And all of that will be posted by June 3rd on CPE's website. And I'll share that link with all of you all today as well. Applications then will open 1 month later. So we wanted to allow anyone interested in submitting a proposal to have about a month to really gather their answers to some of the questions, any contracts or documentation necessary to support their proposal. And then applications will be open July 1st and they will close on August 15th. So we're allotting about 16 weeks. And then from there, we will have about another 1 month review period. Award notices are anticipated to go out on September 13th. So this will allow the steering committee to have about 3 weeks amongst themselves and in conversation with CPE to really review, evaluate, and rank the different proposals. And then CPE, as the final decision maker, will have an additional 1 week to review those proposals before we send out award notices to the entities that were selected on September 13th. One thing that you will note, and this comes directly from the regulations, any selected entity will then enter a contract with CPE before the funds are dispersed. So keep that in mind. That will come after that September 13th deadline. And then there will, as Travis already mentioned, some progress reports that must be submitted to those entities that were selected to CPE. And the dates that we are going to be asking for those are listed there on the screen as well. So one other thing I really wanted to highlight today as we're walking through this different implementation plan strategy that we're doing, of course, with the healthcare training scholarship pot, is what the actual responsibilities of the healthcare program will be if they were selected to receive the funding. This, of course, is also outlined in the regulations, and we're always happy to answer any questions. I know I've already received a couple about this. Is if you are selected, it'll be the responsibility of the post-secondary entity, the credential entity, to actually be the ones that will solicit, accept, and review the healthcare training scholarship application. So they are responsible for doing that part of the process and selecting the students. And then, of course, as Travis mentioned, once they do award those scholarships to the recipients, they will then enter a separate contract with that student to make sure the student fulfills their end of the serving for as many years as they agreed to, with a maximum of 2 years total. So here's an outline of the schedule we anticipate to go by. And so you'll see today we're here at that January 17th webinar. The steering committee meetings, the first 3, of course, as I mentioned, had been scheduled for March, May, and then in July. You'll see we also have that June 3rd date where we're going to release a bunch of the big manual and the templates onto our website. And then, of course, the evaluation period and the award notices. I do want you to note that all the information, our direct PDF of our implementation plan, that's more comprehensive, of course, than this overview today, will be released on our website, hopefully before the end of today, if not tomorrow. And you're welcome to scan that QR code, and that will keep you, if you want to bookmark that, updated as we post information based on funding updates we receive, the different criteria, the manual, and the funding opportunities. All will be housed on our website. Also, the recording to today's webinar, in case you want to share with any of your colleagues, will also be linked there as well. So I know we have gone over a lot of information today, and although we are not doing a formal Q&A, I am going to turn it back over to Dr. Leslie Sizemore to finish us out today with any final thoughts.
Thank you, Michaela, and thank you, Travis, for the information that you've presented to us today. In closing, we would like to thank each of you for participating in our webinar today, and to let you know that a follow-up email will be sent to you with a replay option of this webinar. The implementation plan itself is available, as Michaela said, after today on CPE's website, along with that additional information should you decide you need to dive deeper. We would encourage you to stay tuned for more information about the level of public funding that has been made available by the General Assembly. And we would also encourage you to reach out with any additional questions that you have. Good luck to all of you partnerships who plan to submit a proposal. And good luck to Kentucky on this great adventure with utilizing the Healthcare Workforce Investment Fund to increase our healthcare workforce throughout the state. Thank you.